My name is Ruth Marr. I'm a professor in the Department of Physical Therapy at Philadelphia College of Osteopathic Medicine in Suwanee, Georgia. My co-author is Jenna Iberly. She's a physical therapist at Creighton Therapy and Wellness in Omaha, Nebraska. We'd like to share with you this short abstract which summarises our manuscript titled Concurrent Validity of Transabdominal Ultrasound and Non-Invasive Coccygeal Motion Palpation to determine pelvic floor muscle function in women. The illustration on this slide represents our screening and enrollment procedure. We initially screened 64 women for their ability to perform a pelvic floor contraction in supine or hook-lying position. And unfortunately, we had to exclude 27 individuals, and that was 42%. We then enrolled 37 women, and when they showed up for data collection, they chose a card which assigned them one of three tasks. They either had to perform a pelvic floor contraction, nothing, or a bearing down maneuver. And each task was then performed in three positions: side lying, standing, and sitting. And the order of them were randomized on the day of data collection. On the right-hand side of the slide, you can see a small handheld ultrasound Clarius. We used that and we paired it with an iPad. And as you can see in the screen, there's the bladder base and it's moving cranial, and that's indicative of an appropriate pelvic floor contraction. So all the ultrasound cine loops were recorded on this unit paired with the iPad and saved for further analysis. The ultrasound cine loops shown here are of an individual who was randomized to perform pelvic floor contractions in all three positions. And you can see that the bladder base is elevating cranially or moving cranially in all three positions: side lying, sitting, and standing. And the small photographs that are included to the left of the cine loops are showing you how the coccyx was palpated by the other investigator, with the middle finger on the coccyx and the rest of the hand just relaxed on the gluteals. Then if we proceed and look at the individual who was assigned a bearing down or straining maneuver, you can see that the bladder base is moving caudally. So that's indicative of a bearing down or straining maneuver. And finally, the individuals who were assigned to do nothing, well, you can't really see anything happening with the bladder base. Now the pelvic floor does move in concert with respiration, but it's very small motion. But there's definitely no sign of a contraction or a bearing down maneuver in any of these cine loops. I took these ultrasound cine loops recently of the coccyx of a 57-year-old woman as she lay inside lying, performing a bearing down maneuver followed by a pelvic floor muscle contraction. And it was merely to illustrate to you how much the coccyx actually does move. So in the image on the left, you'll see that as she bears down, the coccyx moves posteriorly. And as she performs a pelvic floor contraction, per the image on the right, or the cine loop on the right, the coccyx tip is pulled cranial and actually sort of cranial ventral. And this is in agreement with MRI studies done several years ago by Carrie Bow. So you may not think the coccyx moves a lot, but you can definitely see it moving in these videos. And the fact that it's quite superficial makes it very easy to palpate. Now for the results. We are very excited to see our sensitivity and specificity values. And as you can see, the sensitivity for coccygeal motion palpation was 94% and specificity of 79%. And the associated positive predictive value was 94% and negative predictive value was 81%. We also looked at the correlation or association between the two. And we found a very strong positive association or correlation in standing and side-lying position with a value of phi coefficient of 0.7. And we found a strong correlation in sitting with a phi coefficient of 0.65. In summary, we believe pelvic floor assessment should be part of an overall screening and systems review in PT practice regardless of the setting. We would like to encourage you all to try coccygeal motion palpation in your clinics for your patients. We also believe that this could be a useful biofeedback method for patients to use at home while trying to do their exercises, and this could help them confirm if they could perform the contractions appropriately. Thank you for listening, and please read our manuscript in the Journal of Women's Health in Physical Therapy.